I'm super pleased to be able to introduce Kendall, who's going to share her lived experience of having multiple strokes as a teenager.
So, hi everybody. I'm Kendall. I'm from Northborough, Massachusetts. And I had my first, first it showed like as a seizure. Like I was just sitting in my living room one day with my mom and my sister and my friend, and I didn't like feel too well. And then that's when it all started. I kind of like passed out, and when I woke up, there were EMTs in the room, and I was just really confused. I didn't know what happened to me. So I went to the hospital, and that's when we found out it was a seizure. And then a year later, I was sitting in my living room again, and I started feeling the same thing that I felt the first time. So I ran up to my parents' room, and I kind of just passed out again. Rushed me to the hospital, and later we found out that it was a stroke. I worked with a couple doctors to like find answers and stuff like that, but overall it was a really scary experience. And I remember seeing like MRI scans of what it looked like, and it kind of like tore me apart because it's scary to see, especially when you're young. So yeah. Then I like got kind of better, and I was able to go back to school. That was a hard transition because at first when I got back, I was having issues with depth perception. And so it was really hard to go down the stairs, like if I was like seeing things correctly. So I went back and I saw Dr. Leeman, and she's been very helpful. And I'm just glad that I get to come on here and tell this story. Thank you.
Thanks so much, Kendall. Are your parents going to share their story as well?
Yeah, so I'm Kim Scott, Kendall's mother.
Kendall's dad.
So it wasn't exactly a year. It was like the end of December of 2019, and then the beginning in January of 2020 that the seizures occurred. For us, it's been quite a journey. We've, you know, as Kendall said, it kind of happened. She was a healthy teenager, always healthy child. And so to have the experience of seeing your child have a seizure, you know, it kind of takes you back. But yeah.
Yeah, it's like, you know, of course it's sort of kind of traumatic, you know, because you never know when the seizure is gonna hit. And for Kendall, it kind of delayed her, you know, because she was 16. It kind of, you know, gave her some delays in getting her license and stuff, because they didn't want her to, because if you have a seizure, I think she had to wait like 6 months and be 6 months clear of seizures in order to go and start even taking the driving classes. So it kind of delayed her in that process. For us, it was like, you know, because you've seen the effects of you've seen the seizure happen or the stroke happen, and you see your child tense up, stiffen up like a board, eyes in the back of the head, and you can't help it. So that's where the trauma comes. And, you know, and again, from being a healthy child cheerleading, gymnastics, you know, and then to see her go through this, it was, like I said, overuse the word, it was kind of traumatic. But to see her overcome and move on and get to college and, you know, gives you promise that everything is going to be okay, because we haven't had an episode now in probably 3 years. So, you know, but in that first year, because you're not sure,
Right.
because just like it came out of the blue before, it could come out of the blue again. But when you get, you know, some years behind you, you think everything's going to be okay. And that's the way, you know, that's my thought process of the whole thing.
And also, like, a big part of, like, when we decided to put her on Keppra, the medication, that was kind of traumatic for me. But more traumatic was weaning her off of it. I was having serious anxiety about that process and what was that going to bring on. And but, you know, Dr. Leeman, as Kendall has said, has been great, very helpful through the process, and we appreciate her. And Dr. You know, she had to see a cardiologist, Dr. Vanderboom. She's been very helpful too in the process. And like Dean has stated, we haven't had any issues since. And she's in college doing well. Yeah, so that's our story.
Thank you so much, guys, for bringing us to your world, and it's so recent, and it's so in the time of the year that this event happened. I cannot be more grateful that you're opening your family heart and story just for us to start thinking, what are these families and everyone that has experienced a stroke or brain injury going through at the moment and beyond that moment. I'm gonna, we usually do all the questions at the end. So I'm gonna now introduce Dr. Leeman, if that's okay with you guys. So we can hear a little bit about the research that there is about mental health and the impact of having had a kid or oneself stroke at a young age. And for those of you that not necessarily know Dr. Leeman from her clinic in person, Dr. Leeman is a child neurologist specialized in strokes, probably one of the most experienced people in the country that has seen the most cases of pediatric stroke, and has many different contributions to the field of stroke. She's part of Boston Children's Hospital faculty in the Department of Neurology, and she leads the research in imaging, outcomes, genetics, moya disease, and many other things. And among those, she's always so in tune and touch with what the families and the kids' experiences, that she also dedicated to team up to research and start answering what is the real impact, what can we do to accompany, to acknowledge even what are we up against. Sometimes it's important to do that. So we're very grateful that Dr. Leeman is talking here in our series, and I'm gonna just not take more time, Laura, and pass it on to you. And thank you so much for all you guys sharing your story. And also I see the curtain coming down. Thank you. And I'll pass it on to Laura. Laura, let us know if you can share your screen.
Wow, thank you, Patty. That was a wonderful introduction. Let me see if I can share my screen, and then we'll go from there. Let's see. I think first of all, I wanted to thank Kendall and her parents for sharing, because I think that they've been very strong through this all, and it's been an honor to see her grow and thrive, and for her to go on to college, and just to hear their perspective, even more so learning from that than I did initially when I met them in clinic. So this is really amazing. So thank you. And thank you Dr. Mussolino and Mara for having me here today to talk a little bit about mental health in parents and children with stroke. So just briefly, what I'll do is give an outline and then kind of go from there, but I'll talk about some definitions of mental health, the prevalence, and just trying to acknowledge that this is something that happens after pediatric stroke. And then I can talk a little bit about some of the studies that are wrapping up through the International Pediatric Stroke Study, looking at different types of mental health outcomes in parents and children following diagnosis of stroke. So I think as you heard, and as we all know, the diagnosis of pediatric stroke is a life-altering event. It changes everything. It changes how you think about life. It changes how you interact with your child. It can be very traumatic for both parents and children, as well as the siblings. And it's not uncommon to develop long-lasting emotions following this experience, not just the diagnosis, but being in the ICU, being in the hospital, going through rehabilitation. All of that can be a lot for a child and for a parent to go through. And as the disclaimer, I am a neurologist, so I do not treat any of these mental health problems or difficulties. I think it's more that I want to at least give some basic definitions to understand some of the diagnoses that are used in general. So one of them is depression, and that's something that we've looked at in our studies, and it's usually presents with sadness or loss of interest. While anxiety can be more about worrying about different things or just being, caught up in those worries. And then the last one that's been more looked at recently is post-traumatic stress disorder, because a lot of these things, like going to the ICU alone, can be something that is very traumatic and lead to post-traumatic stress disorder. And so there has to be some kind of stressor, a direct exposure to trauma, or just witnessing a seizure even can be very traumatic. And then having those memories play back can be very unwanted and upsetting. And then it can even lead to avoidance of situations such as not wanting to go to the hospital again, even for follow-up visits and things like that, or just avoiding anything in general that could trigger those memories. And I want to emphasize that there are plenty of resources, probably not enough, especially given everything that has been going on in the world. But there is importance for therapy, whether it's family therapy or therapy with one-on-one, and specifically cognitive behavioral therapy has been shown to be helpful. Also, I want to emphasize that school counselors can be a great support as you go back to school. And there are support groups such as this one that can be helpful for sharing experiences and supporting each other. And then there's also some community resources too as well that can be helpful, especially like going back to school or getting in-home therapy if that's needed too as well. So to talk a little bit about the prevalence, up to 59% of children have emotional difficulties following stroke. So it happens, and it's something that we should talk about and try and support both the child, and of course we'll get into the parent too as well. 30% of adults who experienced a childhood stroke continue to have concerns for depression all the way through adulthood. But what we do know that can help with mental health is strong family environment and family supports. And that has been shown to improve all sorts of outcomes, not just the motor outcomes, but also the mental health outcomes too as well. So a study that we looked at, looking at mental health in both children and parents at Boston Children's Hospital following the diagnosis of pediatric stroke. We gave parents and children surveys looking for clinical concerns for depression, anxiety, and PTSD. The inclusion criteria included they had to have had an ischemic or hemorrhagic stroke within 2 years of the stroke, and it could be anywhere from a perinatal stroke all the way to a stroke that occurred around 18 years of age. And the children had to be 6 years or older to be able to fill out the surveys and really qualify for the standardized surveys we were using. And what we found was was somewhat surprising. If you look at the prevalence in the general population, 24% of children had clinical concerns for anxiety, while the prevalence in the general population was 2.2%. 12% of the children had clinical concerns for depression, while the prevalence in less than 13 years old is 2.8%, and 13 to 18 years is 5.6%. There was a smaller percentage within this cohort, which was small group of children, had 6% had clinical concerns for PTSD, but that doesn't mean that that isn't something that children experience. It may have been more on the surveys that we were using too as well. What we also wanted to focus on too was the parents. Parents are also at risk for emotional symptoms following their child being diagnosed with stroke. And we found similar results with parents, that many parents, 28% of mothers and 15% of fathers, had clinical concerns for PTSD, which was much less than the general population prevalence. Well, we also saw 26% of mothers and 24% of fathers have clinical concerns of depression, while the lifetime prevalence is 4.6%. And there was a smaller percentage of parents that had clinical concerns for anxiety. There's also been some interesting studies looking at parent experiences. And I thought that this was an interesting study done out of Toronto. What they showed is that they looked at 30 parents of children with neonatal stroke. And what did the parents recall about the discussions that the medical team talked about at the time of diagnosis? Many remembered the motor, the language, the cognitive, and the academic outcomes. However, there were fewer discussions around the impact on their child's social skills, their behavior, attention, mental health, and adaptive functioning, which are important things for us to discuss early on. And hopefully we do discuss them in clinic. But I thought this was an interesting gap in what we talk about in the ICU setting or in that initial diagnosis discussion. Something else that they noticed is there was a correlation between the child's behavior and the parental mental health. Another thing that was in another study done out of Toronto that was interesting is something that hasn't been studied as much in childhood stroke or pediatric brain injury in general, is looking at the parent's perspective and specifically on resilience. So resilience is important. And I think that there's many definitions, but some of the ones that have been used in the adult stroke population is things like post-traumatic growth, a greater appreciation for life, unexpected discovery of personal strengths. And that can be applied to pediatric stroke too as well. And I think it's important to have this idea of the child being resilient, of overcoming what has happened to them, the positive personal characteristics and personality traits or attitudes of the individual in relation to the recovery of their stroke. And I think that that's so important, not just to emphasize some of the hard things that happen with pediatric stroke, but really accepting the resilience of the child too as well. Lastly, I just wanted to talk about two studies that I'm very excited about that hopefully we will publish within the next year. The first one we called PIPS, which was specifically looking at PTSD and pediatric stroke, but we also looked at anxiety and depression. And we were looking specifically at arterial ischemic stroke within the past 2 years of doing the surveys. So we included both parents of children with arterial ischemic stroke and children who have experienced the stroke. And we used the same surveys we used at Boston Children's, but using it with an international group of parents and children as well. And we looked for PTSD, anxiety, and depression. And we're hoping to look at that as well as look at certain, not just the stroke outcome, but also what are the access to care and things like that, and how that affects the overall emotional outcome of both parent and child. So the goal is to determine the factors that protect against the development of emotional symptoms. And the long-term goal is to use this data not only to extend it, but to include siblings. But also I think it's important to develop early screening at the clinic visits whether it's just a brief screening, but it's important for us to acknowledge that this exists and try and help and support both family and child. And lastly, is something I'm very interested in, which is hard to study or to develop, is to develop preventative measures. Are there ways that we can talk to families when they're first getting diagnosed? Are there ways that we can help so that the ICU isn't as traumatic? Are there ways to help reassure families so that they can feel less anxious or less worried about what is to come in the future, as well as what has already happened? And lastly, the study that I think is interesting too as well is called Parental Outcomes in Perinatal Stroke, otherwise known as POPS. So what we wanted to do in this study was to see if we could reassure families, specifically parents of children with perinatal stroke. And there's this perinatal stroke video that we can look at too that discusses a little bit about perinatal stroke and what we know and what we don't know. And with this study, we look both before and after they have use of the video. And then we give surveys to the parents related to emotional outcomes, specifically of guilt and blame, as well as a feedback on the video with the surveys. And I can think that's where I should, let me just talk about the video and then we'll show it. I wasn't sure what the next slide was. So the video was developed by Adam Curtin in Alberta. And so far the participants have been watching about 2.5 times on average. And so I think that the participants really appreciate the video's illustration and simplicity and the real life testimony. And so we wanted to show the video right now, if you want to, I can stop sharing screen and you can do it. Let's see.
Most people are surprised to learn that babies have strokes. In fact, the most focused period of risk for stroke is the first week of life. Perinatal stroke is a focal vascular brain injury occurring in the fetus or newborn. Perinatal stroke is the leading cause of hemiparetic cerebral palsy, lifelong motor weakness of one side of the body. Perinatal stroke causes lifelong disability for millions of people worldwide. Stroke occurs when a blood vessel in the brain is blocked or ruptures. Unfortunately, we do not understand all the reasons why an individual child suffers a perinatal stroke. Many strokes near birth result from a problem in the placenta, the physical connection between a mother and her baby. Small blood clots may form in the placenta and then enter the baby's circulation, traveling to the brain where they block an artery, resulting in stroke. There is no way that a mother or her doctor can predict or prevent such a clot that puts a baby at risk of stroke. Research has also established many things that do not cause perinatal stroke. How a baby is delivered appears to play no role in why his or her stroke happened. This includes the use of medications, vacuums, forceps, or other routine obstetrical practices. Many mothers wonder whether they could have done something different to prevent their child's stroke. In fact, there are no factors that a mother can control before or during pregnancy or during labor and delivery that cause perinatal stroke. Your child having a perinatal stroke has nothing to do with what you ate or did not eat during pregnancy, how much you exercised, or any other factor under your control. If your placenta was sick, there is no way that you could have known this or prevented it. This is not your fault. A definitive cause for most perinatal strokes cannot be identified. This does not mean it must be due to something you did or did not do during pregnancy or delivery. It does not mean it is due to something that felt stressful or unexpected during labor or delivery, or something that your doctor did wrong. It also does not mean that you or your doctor is missing something. Your child's perinatal stroke is not your fault. There is nothing your doctor or any other healthcare professional could have done differently to prevent your child's stroke from happening. Despite this, many parents of children with perinatal stroke experience difficult emotions and mental health complications. The diagnosis of perinatal stroke is a traumatic event for many parents. Burdens on parental and family well-being may last for years or even decades. Research has found the following problems are particularly common. Parents, usually the mother, may feel a strong sense of guilt and personal responsibility for their child's condition. Blame is also common, where parents have strong, persistent feelings that someone else is responsible for their child's perinatal stroke. This might be directed at obstetricians or other health professionals involved in the labor and delivery. Many parents face these difficult emotions. Some may also have symptoms of other potentially serious conditions such as post-traumatic stress disorder, PTSD. Criteria include persistent intrusive thoughts and negative alterations in thinking and mood, specifically related to a traumatic life event. Depression. Criteria include strong, persistent feelings of sadness and loss of interest. If you are experiencing any of these complications, it is important that you bring them to the attention of your physician or other qualified mental health professional. A few other important points we would like to highlight. The risk that your child will have another stroke is very small, less than 2%. The risk of perinatal stroke and subsequent pregnancies is also extremely low, less than 1%. Your chances of having additional children without stroke are extremely high and likely similar to the general population. We hope that this evidence-based factual education regarding the possible causes of perinatal stroke can reassure you that you are in no way responsible for what happened.
Thank you for sharing that. I think it's a very powerful video for sure. And hopefully it was interesting for you all to see too as well. What they're hoping and what we're hoping, I work with Dr. Curtin on this project, is to decrease the guilt and blame that parents feel. I know that there's other emotions too, and those are the ones we have to work on too, to help. And this is the outcome measure called the Parental Outcome Measure, or PALM, that Dr. Curtin developed in Alberta. And it looks at different feelings of both guilt and blame and then ranking them. We're hoping that when we look at the data, that the video has helped decrease some of these feelings in some of our parents that experience the guilt and blame. There we go. Sorry, just can't explain. So that is what I wanted to talk about today. And I just wanted to emphasize that both children and parents may develop emotional symptoms following pediatric stroke, and it's actually very common. What we do know, though, is strong family environment and strong support improves not only motor outcomes, but also mental health outcomes. And evidence for efficacy of mental health interventions is needed, specifically more in the prevention aspect, for ways that we could help to prevent the emotional outcomes that we see, as well as the importance, I can't emphasize how important resilience is, and the amazing things that all of these patients, children, as well as parents do after experiencing such a traumatic event. And with that, I want to thank you for listening, and I appreciate all of you coming today, and I'm happy to answer any questions to the best of my ability.
Thank you so much, Dr. Leeman. This is eye-opening, like just to see how much impact the event that happened to the kid has also in the family and the children. And I'm very in awe. The video is amazing. We also have been using it out of their website at the neonatologist to explain and try to help the family cope with the news. Sometimes it's very difficult. What is super admirable is really doing the research that is needed to guide, answer, what are the needs when, can you intervene? You started with the resources, I loved it. Like you said, you have resources, we need to use the resources we have right now. But I think if you don't see what you're up against, you may not be even asking for help. So I wanted to thank you for the research that you guys are also doing in putting this out and making it part of care, which is so important. It shouldn't be only on the families to figure it out. So we open the discussion now. So Mara will try to moderate the questions, guys. If you want to put it in the chat, we always ask families, as you know, to, if you are comfortable, ask a question yourself. And if not, Mara can read it from the chat as well. Thank you so much, Laura.
Sure. So just before we start questions, because this is a sensitive topic, I will not say your name, but I'll try to read a phrase from your question to indicate, and then you can choose whether to come on to actually ask it yourself. Also, we are asking you to ask questions in general or in conceptual terms, not specific to your child. So sort of, can you generalize to what the issue is? And that will enable a discussion that can continue to be recorded and shared with everyone. We recognize that there's an interest and a need in a support forum that's not recorded, and we can add a session for that, but that's not what this is. Okay, so there's lots of appreciation. Let's see. There's someone who has a teen who had an in utero stroke and then a subsequent hemispherectomy. Are you interested in asking your question, or would you like me to ask?
Hi, yes, that's me. I'm Audrey, and I'm gonna turn my camera on because I'm not on Wi-Fi, and I'm worried that I'll just cut out more. Can you hear me all right?
Yes.
Okay. So my question is, what are there? Do you have like a database, or what are the known resources for families whose children are struggling with suicidality or just other mental health issues, like when they're in crisis? I do have families come to our organization. I work with the Pediatric Epilepsy Surgery Alliance with kids who have that presentation, and I don't really know where to refer them, which is other than back to their clinician and their hospital team. I'm just wondering if in the broader world of what we do, if there are more specific resources for these kids that have these known outcomes and then, struggle with suicidality, depression, et cetera. Do you have any suggestions, or how would you handle those situations? I know it's general and specific. I'm sorry.
No, I think it's an excellent question. I think the short answer is there's not enough resources, but there are some resources. There's specifically crisis centers that you can either take the child to, or sometimes even mobile crisis centers that can come to the child. But part of it depends on the area in which you're at. So it's not like each state has different resources. And so if you're talking about at a national level, I think that makes it hard too as well.
Yeah. Do you think that those like general referrals to like a crisis center, like where is the understanding about the brain injury piece? Because I feel like that's what the concern is that there's not like that, it's a different beast in a way, and maybe it isn't. Maybe I'm looking at it the wrong way, but what's your impression of that?
I think it's all the same symptoms. So somebody who has the background to treat a child or in some cases adult with suicidality is going to be able to treat the child no matter why the suicidality is coming into play. Unfortunately, we don't have specific treatment options, I think, for someone who's experienced this specific traumatic event, but there are lots of different traumatic events and they all end up with the same symptoms, and these people are trained to treat those symptoms.
Thank you. That was helpful. I appreciate it.
Thanks. I'm going to take Crystal, who's raising her yellow hand. That's another option. Go ahead. Go ahead, Crystal. You're muted.
Yeah, there we go. I'm just wondering, for those of us who've had children that have had bilateral strokes and TIAs and seizures, I feel like complex trauma seems to describe my family more than PTSD per se. And I haven't found a lot of resources aside from things that deal with childhood trauma, not so much medical stress related trauma. Do you know if there are resources for that kind of thing?
No, I think that's, go ahead.
That's it.
Oh, so I heard somebody else talk, so I'm sorry. I think that's a really important, I think that medical trauma is in itself a big deal, and it happens no matter how good we are as clinicians. I don't know of specific resources for medical trauma other than my experience with like child life and things that happen at the hospital to try and make things less traumatic. But I think that there's a need for that for sure. And that's something that I'll think about too as well.
So I'll offer that I'm also trained as a somatic experiencing practitioner, which is the work of Peter Levine, and how our stress physiology can get stuck in various states. And there are practitioners who are trained and educated in working with that stress physiology. And it's sort of, you have to look, but I'm happy to follow up and answer questions about that.
I have a quick comment too. There are some foundations that have taken on exactly this, complex medical care children and the families. I know of those, like some that have had even kids that have lost their children, courageous parents. There are foundations that work with, I call it peritrauma, not post, because trauma is constantly happening. You're not sleepy, you are concerned, the kid could have an event, and all the disruptions of medical care that we also have on kids that have medical needs that are chronic and complex. So we'll do our homework and vet the sites to make sure that there is good, robust shoulders of experienced people and serious research on it, and share it through the mailing list, guys. So we are learning with you, so bear with us. And if anyone in the call also knows of something that their center, for example, has been using or has a recommendation, you can put it in the chat.
There's a parent of a 7-year-old who is having a hard time with school and anxiety. Do you want to ask your question?
I'm assuming that's me, my 7.5-year-old. He's actually home today because I just could not get him to school. It's been such a struggle. The anxiety of it seems to be social anxiety. Part of it, I think, was he was on Zoom for like a whole year when COVID happened, and the social struggles just kind of, anyways, so I won't go into that, but I'm just wondering if there are any resources to help me with helping him with anxiety, and especially being around other students. He prefers to eat alone, he prefers to play alone. Anything around other students makes him anxious. And I've heard from other stroke parents that they go through the same thing. So I was just wondering if there are resources out there that I could like link his IEP team to, because it's just really starting to become a hindrance in his day-to-day at school.
I want to normalize that that's something that's going on for sure, not just with children that have had stroke, but just because of COVID too as well. The isolation that happened with COVID has been significant for all children, but I think that it definitely can be different for children that have had a stroke too as well. I think maybe as a team we can look into it. I don't have a specific like person or somebody that I know that works specifically with social anxiety, but there are specialists that do work in social anxiety realms that could be of hopefully great help to your son.
Thank you. Yeah, I do agree that, before all of that happened, he did go to like an early learning center and did all that stuff with all his therapies and stuff. And then when he was home with me so much, he regressed. And I feel like socially he really did. And I feel like, yeah, like you said, I feel like most kids did, but getting back into the swing of things has been quite the struggle. And it just breaks our heart to see him literally melt down to the ground every day and dread going to school. It puts a lot of stress on me and on our family, our work life and our home life and everything like that. So we're just trying to find solutions here. Yeah, thanks.
Elizabeth, there is, are you in the New England area?
I'm not. No, we're in we're in Chicago.
Yeah, that's the other part that we were initially local encounters and stuff, and this grew to an international group of people. So we're trying to be mindful of not saying, oh, you can use this and it's only available for people that live in one place. But I am pretty sure there is one of the talks in our series that social competences that we had review, and the person speaking, you get her email, doesn't, she's in Boston, but she may be able to connect you. She knows a very large network in the country of exactly this. Is mostly for pubertal to teen years, and is to be able to get more adapted and working in your environment, achieving the goals that the kids have. And she's very connected. So Elise is her name. But if you go to the series, maybe that talk may shine some lights, and maybe that's the words that help with the search. But she is also very good at answering emails. If you want to send her an email and say, hey, I'm in Chicago, do you know of any resource that I could be tapping on? And always ask your pediatrician and your neurologist, of course.
Yeah, no, definitely. I appreciate that. And it's just to the point where sometimes when you finally get in to see a doctor, you have to wait months to see your doctor, and you get that small amount of time to discuss with them. They don't see what you see every day, so it's really hard to get that point across sometimes. But yeah, thank you. I will reach out to see if there's anything local, and whether it's Lurie's or something like that.
There is a theme also in all of this. The cost can be really high. There is a lot of that is not covered by insurance of the programs that are more sustained and the therapies. And the access is what Dr. Leeman was saying, is we have way less than we wish for mental health for everybody. That's a reality.
I'm going to keep the questions moving.
Yeah, sorry.
So there's a cluster of questions around when and how to tell your child that they've had a stroke or other brain injury. So I'd be interested. We are actively working to bring that as a specific focus topic to one of these future events, but I'd be interested in hearing from both Dr. Leeman and Dr. Musolino on that.
I can start, and then Dr. Musolino, you can continue. I'm sure you have different practices. I think part of it is not necessarily the age of the child, as if you feel that they're developmentally ready to hear that type of information. And I think they usually, at least for the parents I've worked with, they usually start to ask questions and start to really want to know. And I think that that's when you know that they're ready to have that discussion. And I think what we were working on for a while, it never came to fruition, is to have like some kind of like picture book or some way to help the child and the family have that discussion. And something like that is needed in some cases to really help the child understand what happened and what they can do moving forward. Because I think it's a difficult conversation. I agree.
I echo Laura. And I also ask the kids sometimes in clinic, do you have any questions? Like I try to open a space even very early on, and a lot of times it's like, no. And sometimes I ask, do you know why you're here when they're coming to the medical appointment? And that is kind of starting that conversation. It takes years to get the kid to also be able to speak, and every kid is different and cognizes their body, their being differently. So it's individual, and just asking, I think, is the most important thing. And for the book, Laura, we have someone that is working on it. I would love to have, if you have anyone that can help illustrate it and stuff like that. I'm gonna throw him. Matty Wilkinson has been thinking about his early education and also Feldenkrais, an Advaniel therapist, has been working on this, like how to do a picture book.
Yeah, I think we have something started too. Maybe we can work together and
Yeah,
try. And
that would
I
be
think
awesome.
it'd be great to get something out there because it's so needed.
Absolutely.
And the next question is similar, but for siblings. I don't know what videos for siblings, but I think that any resource that would be for a child who's experienced this would also be valuable for siblings. And I think Jordan, who's on here, has a developing list of picture books that are just generally good about disabilities. And those can also be a good way to start, that everybody has their differences. One picture book author I loved when my kids were younger was Todd Parr. They're very inclusive books, and but there are many others now. There was also one, Righty and Lefty, that's particularly good with our population because many of them clearly identify as being righty or lefty. Okay. There's a question I'm going to ask anonymously, which is really about fathers and their sort of cultural norms about behavior and emotions for fathers, and there can be stigma about them expressing their emotions. So I was even struck in the statistics that you showed how the mothers seem to be experiencing more, and I just am curious if you have any comments about that aspect.
Sorry, I'm the father, and I would be comfortable sharing my story if that's possible. And it's not about my story, so comment and then question as well. But yeah, hi everyone. Thank you so much for the support and putting this forward. While we're based in Toronto, Canada, we had the opportunity to meet Dr. Lottie Merabet from in the eye clinic. So that's great to be here in this session. And we collaborated with him to write some articles about cortical visual impairment in my wife's website. Yeah, so I'm here in late October. I found myself really struggling to cope, and our family, as many, right? We're 4 years into our journey with our daughter. Wife left the workforce, fully focused on our child. Now we have a second, and I'm the sole provider of our family. And many parents, of course, find themselves in a set of struggles. In addition to that, we don't have a family support system close. My wife's family lives away, and my family lives in another country. What I found myself looking for in that episode in late October was for validation. And validation that I couldn't really find from my family because they're in another country, so they have not been there in the last 4 years in the hospital despite their support, similar to my wife's family. And the one result that really spoke to me was finding a couple of TED Talks and videos on YouTube at 2 in the morning from other parents. Dad in South Africa talking about his journey and the anger he felt, and this, that, and that really spoke to me and helped me feel seen and validated. As I reflect in the last 4 years of the journey, I can only pick 2 moments where we had support focused on mom and dad. One, a grief counselor, while we were a social worker, while we were told about our fetus condition 2 months before pregnancy here in Toronto in the Mount Sinai Hospital. So we were presented with the diagnosis and then with options and choices we had to make. And there was someone we could speak to. From my wife and I just stunned. And fast forward 2 months later, where our daughter was born, a social worker who came to ask us if we wanted to go down for a coffee at the lobby of the hospital. Well, they stayed for a couple hours to watch after the baby. And fast forward 4 years later, there hasn't been really a focus on parents. So that was just a question, first feeling heard again in this audience, but most importantly, what are the resources, whether they're local in New England, nationwide, and nationally, that accompany parents and could focus on making sure parents can endure this journey. And if not, I'm someone willing to collaborate and build and volunteer as well. Thank you.
Pick a track for us to go out
Let's do the limit.
Wow. Well, thank you for sharing that. I really appreciate it. I think to start out with the fathers versus the mothers, and then to try and talk about resources. It was harder to get fathers to enroll in studies, and I think that that's partially because they may recognize that they have those symptoms and may not want it to be known, just because of the societal norms, which is not okay. Like, it's not okay, and I want to acknowledge that I think there's many more fathers that are struggling that may not, feel comfortable talking about it just because of society and the norms that have been set up. And so I think we have to break through those and understand that it's not a stigma. It's something that happens after a traumatic event. And I think that's so important to acknowledge. And I'm sorry that you weren't able to get that kind of acknowledgement at the time that you really needed it. I think the other piece is the resources piece, which is like the theme of today. And part of what it is I think there are some resources. It's just a matter of they're not all in like one location that you could easily access and say, here, this is your options. This is what you could do to really move forward and try and heal. And so I think that that's an important gap. And I appreciate that that's being like brought to everyone's attention.
So I want to honor Dr. Leeman's time because I believe she has to go back to clinic. We can keep the call open and field the questions. I'm happy to help, and Patty can help probably for another 30 minutes. There's a big queue of questions, so we'll keep going. Thanks again, Dr. Leeman and Kendall and Kim and Dean. If you're able to stay on, we might call you in to help answer any questions from your experience, but if you need to go, thanks again.
I just wanted to say thank you. I really appreciate all the parents and Kendall and Kim and Dean for being on today. This was an honor, and it's actually taught me a lot by just having the discussions. So there's lots more work that needs to be done, and I hope that I can help with that. So thank you.
Okay, so there's a question about discussing things that the parent is monitoring, potential challenges with vision, or other things without, I guess, causing worry or anxiety for the child. Do you want to say any more about that?
I can, and forgive me because I'm in a kind of public space, so there might be some background noise. But I think, my question is very much related to the other parents who were asking about when and how, to speak with their children. In my particular daughter's experience, we're doing a lot of monitoring. Thankfully, we've had no additional diagnoses or like specific needs since, her second and third day of life when we found out she'd had a stroke. And so it's sort of the nuance of, we will obviously continue to monitor and make sure she has incredible support and want to make sure she understands without actually causing, stress or anxiety. So I think very much related to, some of the other questions of just kind of when and how to speak with your children about stroke.
Thank you, Kristen. I again frame it like kind of more philosophically, starting with there's nothing wrong with them. And it sounds like weird to speak this way, but it's not that something is not working, or it's not that something has been broken. That is a frame that we as adults have to kind of shift a little bit before we talk to them. They perceive that right away. And as you know, the identity of a kid comes from the way he mirrors kind of itself on how the parents react, the siblings react, the peers, the teachers, everybody around them react. So it's important that before we talk to them, we really make ourselves that question as there's nothing wrong with my child. Is a child, it has its own uniqueness. And among those, maybe a perinatal brain injury and a brain injury later in life. And that's what they are up against in terms of challenges. Other kids have other challenges without brain injury. We ourselves have other challenges. So there is nothing wrong. There's something very unique. It's just because there's this child. And if you start with that, then I think questions, and I learned this from our colleagues in integrative medicine, palliative care, questions go a long way. Do you see anything different? Or do you, sometimes the conversation comes out of nowhere. Like they're talking about an apple and they ask you a question about the brain. Like this classic child kind of cognition. They're making their own map at the same time that they're really truly developing their own map of their body, of their thoughts, of their emotions. They're making their own map of how are they fitting or different or equal. We do all of this ourselves. So starting with nothing wrong, the same way that you're gonna get a genetic condition, it's a unique trait that you have. Another trait among many others is that you experience that. And that's why you may see that lefty or righty are different, or how we do things different, or you have the brace that is different. The other thing is, I literally think the questions go a long way. You don't even have to ask them, do you see yourself different? Like when you see them puzzle about something, you just can say, what are you thinking about? Do you have any questions? And then sometimes that opens up what they really are thinking. Sometimes they're not concerned about what you think they're concerned, or they're not struggling with what you think you're struggling. And the other thing is to see them as a whole, like the entire being. But I tell you more specific to the stroke side. I have to start with, like, there is a brain. The brain controls parts of the body. It does a lot of things, even when we think. Well, so, and that comes like in very different encounters and very different ways. And then if they notice something, if they don't notice anything, I try to not go. And as you said, I don't want to make it the abnormality. Okay, so I don't want to bring something that they don't yet notice that is different in themselves. But the same way that they can say, why I'm not wearing that kind of clothes that kid has, or why I don't have those shoes, is exactly in that way that you answer those questions. You're not going to say, oh, those shoes are not for you because you have wrong feet. Like that's the last thing that we would say. So it's when they start noticing themselves in kind of that universe around them that you have those opportunities to ask, and what do you think? What do you see different? And let them speak before you start explaining anything. I remember one kid that asked about if he was gonna die after eating the seeds of an apple, and the parent going on with, no, if there is not poison, or there's little, but it's not enough, and whatever. And these specialists in palliative care asked, why did you ask that question? If you're gonna die, if you eat an apple. And the kid responded that his relative that died from cancer ate an apple and then got sick. You see how off we can be? He's not asking about the seeds or anything. He has associated something. And until you ask the question, you don't know what's going on in their own head. So I highly encourage to make it very organic. Nothing is wrong with them. It makes them more unique, more beautiful if you want to, because they're more unique. and then yes, there are going to be challenges that we all have. And then just drive it from questions. I don't know if anyone else, Mara or others, have other ways of maybe contributing to this answer.
So I think one thing that's important to think about, especially in this context of mental health for parents, as distinct from mental health for the child. So we are separate from our children, and we can be worried about things and take those worries to other adults as an outlet. Out of earshot of our children sometimes is the best way to do it, because that can take the charge out of it. So you can be observing your child to know when to escalate or when to schedule an appointment without involving your child at all, right? And then you call the professional to say, I'm seeing this and this and this. Do we need to do anything I would hesitate to put the pressure on your child about what you're observing until you get another opinion. So that's just one thing. And it sort of feeds into the next couple of questions. So I'm going to keep moving for variety. So this is a mom to a 6-year-old who has mental health clinicians resistant to work with a child due to diagnosis or presentation. So it's epilepsy presenting like the autism spectrum. Are you able to ask your question? I think Patty has experience with this kind of population.
Yeah, absolutely. Thank you. So I'm actually part of Audrey's community, the Pediatric Epilepsy Surgery Alliance. And so I have a 6-year-old who's really struggling. And I think there are many families like ours who, because of his surgery and his diagnosis, present certain ways. And so I think clinicians on paper, when he presents on paper, make an assumption about what he's able to do. And when he presents in person, it's very different. And so I'm just really curious if anyone else has had this experience of having to really reassure mental health clinicians that he's able to engage in a therapy process. I think it would be very beneficial, but it's a struggle to get somebody's buy-in to actually initiate and engage with him, not on video, which I know is a systemic issue. The lack of services, the difficulty finding services, and then finding somebody who's resistant to work with your kid because of what they look like on paper and without giving it a shot. And a lot of our kids who really could benefit from mental health support and somebody who's willing to work with them and try some things out. There are going to be executive functioning deficits based on his medical diagnosis. And how do we encourage and support our mental health clinicians to try to engage with our kids to see what we can do to help support them.
Thank you, Amy. This is we're kind of challenges, and they're very different and unique. The places that have most resources, sometimes you have to go off your diagnosis, like if you're a seizure or a stroke, and you go to those clinicians. Like I speak for myself. When you come to the pediatric stroke clinic, we have a physiatrist. We do have a child psychiatrist that comes in when very needed, but it's mostly for the acute and then the physiatry for the rest of the life. But we have almost no resources for the mental health. Just to give you an idea, and this is an academic big place and tons of people. What has all the resources in my institution alone is the Lurie Center for Developmental Problems. So I specifically refer them. And I specifically say autism without a brain injury is not the same as the category of autism that is given to these kids with brain injury, or any cognitive impairment, cognitive behavioral impairment given by brain injury. And they know it very well. So what I do is I refer them. This is a frame that I'm gonna maybe provide, and you may wanna try it locally. You need to have the person that knows the neurological side had a little referral, and it could go in the comments even of what are the concerns, but have the evaluation done in the developmental side of the institution. And if they have an autism center, that's a place you want to go, because that's where it will carry that developmental disorder code that opens the resources for that kid. And they do have a much, much more experienced crowd to even ask questions and to have counseling, social worker, finding the resources in your local community, getting the services from the school system that can be given. And sometimes you can de-stress a lot of the anxiety these kids go that feel they're not being seen even in school because they can't communicate in an effective manner. And that can go a long way if you have a more personalized one-to-one, or even the communication strategy is delineated by a developmental specialist. So I'm giving you and probably a little bit related to what you're talking about. You go to the place where currently most resources are present. And for these type of behavioral cognitive problems, mental health, we rely on our resources where they are here in Boston, for example, the Lurie Center is one of them, but there are equivalents in most of the big like cities in the country, for example. And And we don't just send the parents to go alone. We try to send a letter, or you parents take your stroke or epilepsy note. So the person that is in front knows that there is a correlate, like an organic neurological correlate to that behavior. That also helps them frame things, look for other resources, and even the communication strategy changes a lot when we have those conversations. I put my assessment in those notes so they can see what things I expect to be a challenge.
Thanks. The next one's a parent of a 7-year-old asking about how to conduct medical or therapeutic appointments with kids that are sensitive to the kids' needs. Do you want to ask or?
Hi guys, I would ask, except my cat is hogging the screen. But basically, Mara, clarify if I'm wrong or I missed something. But yeah, you know, we got these medical appointments or even therapy like that post, 5-minute, 10-minute therapy chats or whatever. And I feel for my 7-year-old. It's like since he was little, and even, I mean, Dr. Mussolino, you wrote the book on being like child-centric at these like, he does feel like you're his doctor versus like adult to adult. But even so, we spent so much of every appointment talking about him, in front of him, dwelling on the challenges, because we got to make the most of your time. And, healthcare is not structured for you to be able to, have really good like post or pre, like adult, like how can we be successful, honor the child, but make it very efficient, very effective?
Oh, here's my dream. My dream is to have supporting clinics, which doesn't happen necessarily child life, where we can have part of the encounter with the parents, the kid being attended, playful, in an environment that he feels safe with the parents right there, not far away. So we can have those conversations. And in fact, I have a lot of parents, kids that are more traumatized by anything that respects to medical care, where I request and schedule these things. They're not so available. So this is another alternative. And this is maybe a theme for how to deal with mental health. And I want to point people also to this new kind of way of approaching the way we see and treat our children with disabilities in a moment. But in more general terms, coming to the encounter with someone that not necessarily you want to have present talking to the doctor. It could be a friend, a neighbor, a cousin, a grandparent. There's someone that you can ask them to go to the cafeteria to get something. That helps a lot. And you guys requesting that at the beginning of the encounter, in the middle of the encounter, I'm going to say, like, whenever you think is necessary, is very, very helpful. Because as you said, we have a moment where we are focused directly on the kid, and we talk one-to-one, and we do the exam and all those things. But then the rest of the appointment could be much, much less traumatizing in a way. Like being there also for a long time. These appointments tend to be longer than average. Yeah. It could have detrimental effects. I try to bring them into the conversation to whatever we are talking to them, or saying things that I will be telling them and asking them questions. But I totally agree that we, in a way, exposing them to this personalization kind of experience where they're not there. So we could do better, bring someone to those encounters. We're very flexible. You should ask your doctors to be flexible, the therapists. And the other thing is, we're getting better at having some of these conversations in a virtual encounter now that we have the ability to do it, and then concentrating the clinical encounter with the kid just on the kid things and requesting that as a secondary. We not always can do them. We don't have capacity sometimes, but you can always ask. I think that's something that you could.
Our PCP at the last annual, because we actually just had to leave because my daughter tested COVID positive just like that morning, right? But he said, I'm happy to do a virtual parent only, and it was so helpful in that 30 minutes of asking literally hours, years of accumulated questions. It really set my own anxiety much more at ease, because he was able to speak in a shorthand, way to address our work. And we were able to say out loud really the things that were really So thank you.
And when you're doing those encounters, same thing, look for someone to take care of the kid. Don't
Yeah.
have them in the background listening.
I
to
know,
the
listening,
conversation.
even
They
with the
are
TV,
listening,
they pick up
even if they're 3 years of age.
Yeah. One thing, Mara, I'm again, like for interest of time, I'm happy to table this later, but like Elizabeth's social anxiety stuff, as you know, like we've struggled with that. I have a couple of things that has worked for us.
Great. So more than any of our other educational sessions, I feel like I have to watch the recording of this to mine it for all the resources to then share with all of you. So I'll be following up both with the chat and then any recommendations you send when I send out a survey this afternoon. If you have resources to offer, please send them in and I'll collate them and send them to everybody.
Okay, great. Thank you.
So there's a question about giving kids the words to answer peers' questions, and you can ask that. And then I actually want to open that up to see if I'm going to put us in gallery view here for the recording. I don't know if that mom is still on. Maybe not. Does anyone want to share how they've supported or helped their child to share about wearing an AFO or a constraint splint or any other difference that's visible?
Mara, I can chime in. One of the things that we do with Brian, or you, when you're gonna comment.
Catherine, you need to unmute.
Oh, Catherine is talking.
No, I actually got my hand up there by mistake.
Okay.
I was gonna respond to your question about just when you meet I have a teenager who's a stroke survivor, thriver, and there's a lot of resistance just in terms of his ability to even allow anybody in that he can talk to. We just happened to have a meeting yesterday with his doctor, and it was the first time I really felt that he was part of the team, and he's 16. So it's not as though the peer thing is something he's looking for, but it's something I believe it could really benefit him once he gets over this hump, being 16, teenage, not wanting to sort of stand out at all. There's not a wheelchair or a leg brace or various things that would say that publicly, but there's a lot going on emotionally. So anyway, the hand was only up because I couldn't figure out how to put it down. So sorry.
Okay.
But that's a big topic. So
thank you.
Thank you, Catherine. For the things that are different in the appearance, we usually try to, again, you can ask when they see an AFO, one of the things that we use is like, we are using this so it makes you faster, because it's true. They can still ambulate without an AFO, but it will make them faster, able to play, able to do things. So it gives them more ability. And I have seen also all kinds of other explanations given by siblings, which I find very, very useful of why an AFO is so cool. But I have to say, if you have the ability to connect with another family that has a kid that wears an AFO, there is nothing like seeing that someone else is also like me. That has an appeasement to it, to knowing that I'm not just what I'm going to say in statistical terms, anomaly, okay? I'm not in the norm. And I think so, seeing and relating and playing or having experiences with other kids that may have other uniqueness, I think goes a really long way, and you don't have to put any words on it. And the second one is, I always think anything that looks different that we are putting on them on devices is to increase your abilities. We are making you stronger. You can use a hero, like the heroes all have special gadgets, okay? So there is no hero without a special gadget. You have either a shield or kind of like, or a sword or like things underneath. So it's a special gadget to give you more abilities. That's one frame of, thank you.
Jen, did you want to chime in?
Jen, you're not muted, but it doesn't seem that we are hearing you. Do you want to mute and unmute? Okay, here you go.
Can you guys hear me now?
Yeah.
Yes.
So sorry. So I have a 4.5-year-old daughter, the light of my life. Love her. She wears an SMO on her left foot. She's a right MCA, and she has always really liked picking it out. And so like investing in her, like thinking, oh, this is so cool. Let's look through the catalog and pick out your pattern. And just recently we got fitted for orthotics. So we're moving away from braces to orthotics, which I was so excited. She's going to be able to wear shoes that she wants to wear because she's been restricted to like sneakers. But the investment in her with the different SMOs that we had an AFO, we've had multiple. One of the things that I've explained to her and worked with her on is to really make sure that she knows cool kids wear these, that also you can pick it out yourself, you know, a full carte blanche, let her pick it out, but also that without it, for now, we're helping get you stronger, but we're also helping, you know, just in case the off chance you roll your ankle and something happens, you could be worse. So we're trying to be preventative. And I think for some reason, this little brain of hers gets the preventative measure. And I think that that's kind of been a really great thing, but now we're going into an orthotic and she's kind of freaked out. Like, what if I hurt myself or roll my ankle? And I'm trying to figure out good ways to tell her, this is a very big step because you have been getting stronger. You have built up all of this, you know, like most of her tone is gone. And just, you know, overall trying to like encourage her. But we've just been really the proactive, like, this is a cool thing to wear. And just recently, one of her friends that has not had a stroke has been put in bilateral SMOs. And she was talking to him at his sister's birthday party. And he was showing her his, and she was like, look at mine. And it was so cute to see them totally normalize their braces versus it being like, ew, you're wearing like, and all the little kids around them were like, oh, what do you guys got? We're like, we got cool braces on, you know, that kind of thing.
Thanks so much for sharing.
Yeah, there's so much in what you're sharing. There is a possibility of transitions. Nothing has to be absolute, and one day to another one, we stop with one and start using the other one. You may want to let her wear a couple of hours one, take it out, wear the other one. Let her feel more comfortable and like into the new stuff, and it could be a transition back and forth. So that's one thing that you may want to try. She has a sense of safety that she developed with this other device. We should acknowledge that sense that it might feel a little bit of scary,
right?
And give her the flexibility. But I think the fact that you also have the ability to meet other kids with that, it goes such a long way.
Amy, did you want to jump in?
Yeah, I just want to say, you know, in regards to feeling different wearing devices, we take a little bit of a different approach to normalize it, where we say it should feel no different than, you know, I wear glasses or somebody wears a hearing aid. It's just all of our bodies need things to help us function and move and grow and be and see and do. And this is just what your body needs. And so to make it not feel like a big thing, to make it feel just like everyone else, generally has worked. Sometimes not always, but I think trying not to make a big deal out of it has been very helpful.
Great, thanks so much. I am skimming through all the comments that we didn't get to, and I'm gonna just focus on the last one, which is, this has been the most active chat I've seen in any of our educational sessions, and we've had a lot of engagement along the way. So this final question is, will there be future meetings focused on mental health? And there's clearly a strong need. We just need to identify the experts to accompany other families for their stories. So we will work on that. If you have people to recommend, we'd also love to hear from you. So I will send out a survey this afternoon, and I will spend time to go through all the chat comments and resources as well as those mentioned throughout in the video.
Thank you,
Thanks again.
I want to point to Bonnie Thompson in the chat had put several resources and has a lot of experience. Bonnie, I'm pinning you on helping us with the next one. Because I would like to have the expert and the parent that became an advocate that can help us kind of tackle this. And there's not going to be enough. We will keep doing many more of this, but thank you so much for sharing, for opening, for being here. Thank you, Mara, for driving this series and the Pediatric Parent Advisory Committee here that is always like working. We do need your feedback, guys. So try to put in the survey if there is someone that you would like to also bring to share with the others. So their expertise, that's what we're trying to build, a community that can help each other. Thank you so much. We'll see you on the next one in the new year, I think. Is that right, Mara? We don't
Yes,
know.
the next one's adaptive gaming on January 20th.
Awesome.
Thanks. Happy holidays.
Happy holidays, guys.